There's a few barriers that we come face to face with each day. The major one really is just efficiency in receiving the prescriptions. A lot of the hospital is very busy at the moment, is overrun, and they don't have the workforce to get the work to the pharmacy department for us to process. So with EPIC, we will, once that prescription has been processed by a doctor, it will be sent electronically straight to the dispensary, and that will sort of cut out the middle person, as it were, and getting that prescription to pharmacy. So hopefully by taking that barrier out, it will speed up the process that we can get the prescription out, and also the timely fashion that a patient can get discharged, really.
I think the main barriers at work at the moment are all the paperwork. So we've got 3 or 4 different systems. We've got ICE, real-time and JEC. ICE especially is where the discharge summaries are printed, and then it comes into pharmacy with drug charts. So there's a lot of paperwork that could potentially go missing.
Which I think having EPIC with an electronic system will mean that we'll have sort of less kind of medication errors, and it will kind of overcome that as well, and that will sort of benefit patients and help with the nursing staff as well with sort of minimizing errors.
It will reduce the need to for paperwork that will go missing eventually, and everyone in the whole hospital will have access to the same system. So if a patient's drug chart, whether it's a drug chart or discharge summary, all the nurses could access it in one place with one login.
So I think the way EPIC works is that it's very streamlined, so it will allow us to pull out data in terms of things like prescribing errors or the meds that are prescribed and specialities. And I think that'll be a really powerful tool for helping us improve our sort of auditing process.
Well, it will be safer. We'll be able to read the prescriptions. It will prompt the doctors, or the prescribers I should say, to write every single bit. So if you've got a complex IV infusion, you'll get a rate, a dose and everything. It will prompt all those things to be present, which makes a safe prescription.
I think one of the barriers that we faced at the moment is the patient contact. It can be quite hard for patients to be able to access their medical records, but I think with the implementation of this new electronic prescribing system, patients will have that medical record accessibility, so it will help them to be able to remain compliant with the medication that they take on a regular basis.
Without question, the most exciting project that we've been involved with, certainly pharmacy, but for the whole trust, and the opportunities that will bring primarily for patient safety. Medication safety is hugely important, and the system will allow alerts, warnings for all the prescribers to see before they prescribe medicines. And I think all the staff are kind of fully engaged, and really looking forward to kind of the new world.